More men than women die by suicide, at least according to a lot of sources, even though more women than men report having suicidal thoughts, as well as more non-fatal attempts. Otherwise put, more men than women die from suicide, but women report more suicidal thoughts and attempts than men. Women think of suicide more, while men commit suicide more. According to the American Centers for Disease Control and many more sources, men account for upwards of 70% of all reported suicide deaths. However, according to the American Foundation for Suicide Prevention, women are 1.5 times more likely than men to commit suicide, even though men report greater success. Some explanations are offered, and they're quite interesting. For instance, the interpersonal theory of suicide assesses how suicide desire and capabilities develop. According to the theory, suicidal desire emerges when individuals experience intractable feelings of perceived burdensomeness and thwarted belongingness, and that near-lethal or lethal suicidal behavior occurs in the presence of suicidal desire and capability for suicide. Men are way more fearless of death than women, and men can tolerate more pain than women. As a result, men tend to use more lethal means when it comes to committing suicide. Compared to women, men use more violent approaches to suicide. For instance, over 50% of male suicides involve a firearm, compared to 30% of cases involving women. Suicides by a firearm have a 90% success rate, compared to the 10% success rate for cases involving self-piercing or burning, suffocation or hanging, and overdose. For most men, the first attempt at suicide is successful, while most women live through their first attempt. Less than half of men who commit suicide have a history of struggling with related tendencies, whereas more than 50% of women who commit suicide have a related history. Women report greater levels of desire for self-harm compared to men, but their approaches are not as lethal since the motivation is often non-suicidal, with the opposite being true for men. Self-harm among women focuses more on communicating distress or seeking to change other people's behaviors or reactions. Besides, major depression is twice as common among women compared to men, a phenomenon that increases suicidal behaviors among women. A rather interesting or not so interesting development revolves around the fact that suicide is more common among transgender compared to the normal gendered people, the rates being like 2 times over the national rates, and 6 times over the general population. Since the whole movement has recently taken a political dimension, the explanations are quite divided.